Dr. Shamloo.
Thank you, Helen. All right, good morning, everyone. Great to be here. First, I want to thank PCOH for this gathering. I mean, it's been a wonderful event so far, right? So maybe a round of applause for PCOH. And everything they do, honestly, Helen was saying they sum up everything on this one sheet, but, you can't even summarize it in a book. They do a lot, and I witnessed that a lot of times. So it's great to have a partnership with them. So today, I am going to do several things. I'm going to try to provide a brief high-level overview of Pennsylvania's Medicaid program. Also going to give a brief description of DHS involvement in various projects and initiatives where we try to address access to care, and recent updates that are important to our MCO partners, to our providers, so that you all can do the work that you continue to do. Before that, I just want to give a little again, high-level overview of our program here in Pennsylvania. So our Medicaid program is called the Medical Assistance Program, formally here in Pennsylvania, or MA. It's referred to MA, not to be confused with Medicare Advantage. So that happens sometimes, but medical assistance is also referred to as the MA program. We serve over 3 million beneficiaries here in Pennsylvania. It's about a quarter of the state population, so it's a pretty robust program. We have a fee-for-service delivery system where we serve about 3% of our beneficiaries, but we're a heavy managed care state where 97% of the beneficiaries are served in our managed care delivery system. And we have two programs. We have the Health Choices program. We also have the Community Health Choices program that serve our beneficiaries. So the state contracts with the managed care organizations to deliver these. And we have 8 managed care organizations. Again, here in Pennsylvania, the dental program is carved into our physical health services. So the managed care organizations, 8 of them, 4 offer services to our Health Choices program, 3 both Health Choices and Community Health Choices, and 1 only Community Health Choices. And all of these managed care organizations have what we refer to as dental benefit managers that administer their dental benefits. And we have 6 of those in Pennsylvania. So I give you this overview where, so you have an understanding of how big our program here is in Pennsylvania. And that sometimes is great, but sometimes also offers some challenges that we need to address. In 2024, we had over 9,000 licensed dentists here in Pennsylvania, and these numbers are pretty similar for 2025. We can't really have 2025 numbers until next year, the way we pool data. In 2024, we had over 2,000 enrolled Medicaid dentists, and that's about 24% of the dentists that we have here licensed in Pennsylvania. And then we had over 1,300 meaningful dentists. And that is the way we define meaningful here in Pennsylvania, or at least the way we pulled this data. There's many ways, by the way, you can pull and manipulate data, as some of you may know. But if you define how you're doing it, then it's much more meaningful to your audience. So the way we defined in this poll is those treating 100 plus beneficiaries, right? Sometimes dollar amounts are used. You've seen PCOH show it that way. So we just find a way where we can see what are those most impactful providers, what are the numbers. I always get questions, where do I go for information? So I've just provided some links for you all that you can have when you receive this presentation. The first one is to the Department of Human Services website that you all can go to for so much information. The Office of Medical Assistant Programs, where I do most of my work. So I am the Chief Dental Officer for the entire department. And so the different program offices rely on me whenever they have anything dental related. But 90% of my work is done in the Office of Medical Assistance Programs because that's where we administer our Medicaid program. I also do a lot for the Office of Long-Term Living. This is where our Community Health Choices program is administered, and of course, there are dental benefits with the Community Health Choices program as well. Links there to the Health Choices website as well as the Community Health Choices website. And there's a lot of publications that are associated with each of those programs on those websites that are very relevant to a lot of stakeholders, right? So a lot of times people ask me, well, what are the MCOs responsible for? What are the obligations they have? Well, we have contracts that are public. We have contracts with those MCOs that clearly, in all almost 900 pages, lays out what the MCOs are responsible for. So the contracts are there on those pages that you can look to for a lot of the answers that you may be seeking. What's new at OMAP? This is an important site because it lists all of the MA bulletin, right? The medical assistant bulletins that go out that are relevant to our providers. It also lists some of the remittance advisories that go out. So any information that we put out for providers in terms of the program, you can find in what's new at OMAP. Compass, of course, is where individuals can go to apply for benefits, and then we also have the provider enrollment information page here, where as a provider, if you want to go and enroll to become a Medicaid provider, that's where you would go. DHS is involved in various initiatives and projects, and most of them actually happen to be with the Department of Health as well as the Pennsylvania Coalition for Oral Health, and we're very proud of that. We were just in a 2-year collaborative project with the American Dental Association, headed by the American Dental Association, where we were one of 6 states selected in defining a blueprint on how states can improve their access to care. So that's going to end actually next month. So we've been in this project for 2 years. We do have some results, and at some point, hopefully, we can share those results with a lot of you. But we've partnered with a lot of stakeholders in this project. Certainly, the Pennsylvania Dental Association was also part of the team here, and we were able to accomplish a lot. Pennsylvania was one of 11 states that was competitively selected for a learning series through the Center for Healthcare Strategies. And again, our partners in this are PCOH, the Department of Health. We also have the Pennsylvania Dental Hygienist Association involved in this project with us, because I think that's very, very important. We haven't really done too much with this learning series yet. We've only had, I think, 1 or 2 meetings, but that's supposed to go on till April of next year. So we're looking forward to learning a lot about how to address some of the workforce issues that we have that really prevent us from improving access to care. Also part of the Building State Capacity for Integration Learning Collaborative, that is something, again, we're partners with the DOH and the PCOH in really looking at how do we integrate oral health care and prenatal care, right? How are we able to really at that level provide the care that the pregnant individuals need to make sure that their oral health is addressed and hopefully the oral health of their newborn. So this project, it's a very collaborative style. Again, we have various states that are part of this, and we get together on a monthly. It used to be monthly. Now it's, I think, a little bit less often, but we get together on a cadence where we focus on what next steps are in everyone has an action plan, and we try to stick to that as much as possible. DHS also attends the SHIP Goal 3.1 work group. The Department of Health, in collaboration with Healthy Pennsylvania Partnership, develops the SHIP. It's a 5-year strategic plan which defines goals, objectives, and strategies to improve the health of all Pennsylvanians with a focus on health equity. So that's a very important component. There are 3 work groups: health equity, chronic disease prevention, and whole person care. We participate in the whole person care work group, Goal Team 3.1, and this is effectively to address increasing access to medical and oral health care. So, what's new? What is new? So I've kind of provided a link to everything that we've put out in terms of communication from the department that really gives you an idea of what we've done more recently. One of the things that we did was we adopted the American Academy of Pediatric Dentistry's dental periodicity schedule, right? So before, Pennsylvania had its own dental periodicity schedule, really did try to use the AAPD as a guide, but through stakeholder engagement and persistence by certain stakeholders, we decided that this is the best move for us to make, is to adopt the AAPD's dental periodicity schedule. We also did a program dental fee schedule update. And there was a little bit of confusion on this, so I want to try to clarify that for a lot of you. We didn't change a lot. What we did was we kind of formatted it to be in what is considered standard these days for frequencies and limitations for a lot of the dental services. So we didn't reduce or take away any of the services that were provided. We did not eliminate any procedures. This was just to clarify for providers how many times they can do these procedures and what is really the guidance, right? One of the examples is, so for some of the procedures before, we had 1 per day, right? And a lot of us who are in the dental world know 1 per day doesn't make sense, right? So we kind of adjusted a lot of those to make sure that they are what they need to be. Okay, so the next 2 items really talk about the dental benefit limit exception process. And this is very important because, again, we're still working through this. Yesterday, you heard, I think it was Tammy, who mentioned the dental benefit limit exception and how that came about. So in 2011, again, to kind of reiterate that, where that came from, in 2011, the administration at that time reduced the adult dental benefits in Pennsylvania. And what they did was they came up with a dental benefit limit exception process whereby certain individuals who met certain criteria were able to have access to those services that are on the dental benefit limit exception. And for many years, as she stated, providers were not aware of how to really go about obtaining approval for that exception. And our MCO partners also were not clear on how to be administering that. So in 2021, there was a streamlining, right, where the department put out some guidance and tried to let the providers know that if a member has 5 medical conditions, then the BLE process should be administered differently for those individuals. Again, there was some confusion, and what we found out was the way that it was being implemented on the MCO side was not really aligned with what the intent was of the department when they put out that guidance. So more recently, in June of this year, we actually put out an ops memo. An ops memo is an operations memorandum that is specific for MCOs and gives them guidance and instruction on how to administer certain policies that we have, whether it's in their contract or otherwise. So in this ops memo, and there's a link there, I really encourage you all, especially the providers and the provider entities, to really focus and go and read this because it provides a lot of information on how the BLE process should be administered and how the approval should be done by the MCOs, right? So right now, if you have 5 medical conditions, right, if you're an adult, of course for children, everything is covered under EPSDT, right, up to age 21. But if you're 21 and older, again, we talked about how there's limited adult dental benefits here in Pennsylvania. But if you have 5 conditions, right, if you have diabetes, you have coronary artery disease and the risk factors associated with the disease, if you're pregnant, if you have intellectual disability, or if you have had cancer of the head, neck, or face, these conditions allow you to have a benefit limit exception for the category of services that are on the BLE, which are endodontic services, periodontic services, crowns, and then dentures beyond the once a lifetime limit. So you are entitled to receive those if you have one of those 5 conditions and if that procedure is appropriate, right? And that second "and" part is important, right? So just because you have those conditions doesn't mean you will get the procedure if it's not appropriate, right? So if you are approved for the BLE, then the procedure has to go for clinical review, and if it's appropriate, it should be approved. Again, this is very important for providers to understand, and if you have any questions about this, you can reach out to me directly, and I can guide you further. But there's a lot of useful information. And we also put out a new form to accompany that. Operations memorandum, right, through a MA bulletin. So that way providers can easily mark off one of those conditions and be able to seek approval for a BLE. We also aligned Pennsylvania's EPSDT periodicity schedule in its oral health section to be more in line with the AAP's periodicity schedule when it comes to guidance for oral health, and we're still going to continue working on that to have more alignment in the future. And then we also, a little bit earlier in the year, put out more guidance on the application of topical fluoride varnish. And this, again, was an operations memorandum, not a medical assistance bulletin. This was really, so we had a lot of questions from our stakeholders in the medical community, right? Who can provide fluoride varnish? Who can do this? Who can't do that? Really, you know, one of the things that I want you all to understand, the Department of Human Services doesn't have the authority to say who can do what. That's a scope of practice question that's in the Department of State with the State Board of Dentistry, right? So I can't or the department rather, cannot say what can hygienists do, what can dentists do. That's really up to the State Board of Dentistry. What we can do is say who can bill for what, right? So those are 2 separate things, and I hope you all can appreciate that. But what we were faced with is stakeholders saying, well, can medical assistants, for example, in the medical setting, can they apply topical fluoride varnish and then the supervising physician submit for reimbursement? So we put out this guidance that says, yes, if the supervising physician wants to and thinks is appropriate and has properly trained any personnel, clinical or otherwise, in their office to do this, they are certainly able to do it if they want to, and we will reimburse the billing provider for that. And that's always been the case, but again, stakeholders wanted some clarification from us for that. Also, in 2024, we introduced some language into the Health Choices Agreement. Again, that's the contract between the state and the managed care organizations in delivering healthcare services, including dental, to our beneficiaries. We introduced language that asks the MCOs to engage with our dental schools to come up with a value-based purchasing dental school pilot. This language is continuing in the Health Choices Agreement, was in 2025, will continue in 2026. But what happened was, now it's been there for a couple of years and there hasn't been much agreement, let's say, between the dental schools and the MCOs. So what happened is they came to us and they asked for more guidance, more involvement, right? We were trying to allow flexibility because we a lot of times find that if we allow for flexibility, then 2 entities can really work together and come up with a program that's feasible on both ends. But in this case, they actually reached out to us. They want more guidance, both sides. They want more involvement, so we are going to do that. And in reviewing all of that feedback, we're going to look at the next steps and develop some language that is a little bit more prescriptive in the upcoming agreements. And you know, a lot of people ask, well, why are we doing this? So the dental schools, they really are important. stakeholders in the Medicaid environment, right? They see a large population of Medicaid beneficiaries. They're responsible for educating our students, right? Making sure they are competent dentists when they graduate. And, you know, we want these students to have a good experience with their Medicaid patients, right? In hopes that once they graduate, they are going to consider perhaps working in that environment or becoming enrolled in our Medicaid program. So if they have a negative experience, they're less likely to engage, right? So this is all to address all of those concerns. Ultimately, keeping the well-being and of the beneficiaries in mind. That's the most important goal. Some of you may or may not know about the Rural Health Transformation Program. This was a funding opportunity authorized by the One Big Beautiful Bill Act that was signed into law. It provides $50 billion to be allocated to approved states over 5 years, $10 billion each fiscal year, beginning in 2026. So 50% of that funding will be equally distributed. The other 50% for each state will be allocated by CMS based on a variety of factors. And there's kind of ambiguity on what those factors are, but that's going to be at the discretion of CMS. The specifics are in the Notice of Funding Opportunity. I have a link for any of you who want to go and find more information about that. There are 5 strategic goals there. The application deadline at this point was November 5th. We actually engaged with a lot of the stakeholders, and we asked for feedback, for recommendations, for suggestions, and all of this was collected, and Pennsylvania did submit an application. And from what I hear, all 50 states did submit an application. And I'm proud to say that oral health will be part of the proposal that we have submitted, and we are going to try to address oral health in various ways if and once we are funded. So that's it. But I kind of want to offer some comments based on everything that we've learned. And this has been a great learning experience for me, right? Sitting through yesterday, and I look forward to today because, you know, we keep asking, what are the next steps? What do we do, right? And a lot of that can be answered right here in this room, right? All the wonderful things that the deans are doing, all the wonderful things that other individuals are doing, whether it's on an individual level or on an organizational level, right? But what I think is important for a lot of us to realize is that it starts in the community, right? We need community advocates for oral health that are part of that community, that have ties and have connections to that community, right? What's happening in Tamaqua is great, right? But you need someone from that community, like Micah, right, to be able to coordinate, to be able to be that quarterback, to bring together, Senator Argall and Representative Barton and Dean Ismail, right? Without him, that wouldn't have happened, right? You need these people who are passionate about their communities, but also looking out for oral health to do this. You need individuals like Dr. Verber, right, who's probably very busy, but he realized there's a need, there's a shortage in his community for a workforce, and worked with a local college to set up a program. So a lot of times, we need to look within the community to have champions to address these concerns. And the other thing we have to remember, I think, is that you can't necessarily just take an individual, put them in a rural environment, put them in an isolated environment and say, okay, now do dentistry. Dentistry is a profession that's very stressful, especially if we're going to rely on individuals that are just graduating, right? If some of you can remember that time, you don't know anything, right? It's a very stressful time. You need a lot of support, and that support has to be looked at in a very holistic way, right? Yes, it's wonderful to provide them with the means to be financially successful and how to run a business that's lucrative in the Medicaid environment. And you'll hear a wonderful presentation by Dr. Norris this afternoon that will go into that a little bit, right? But you also need professional support for this individual, so they have some mentorship, right? So that they're not out there doing this alone, right? Because a lot of times that's going to be the case. You're going to have this individual who just graduated by themselves in an environment where they have to provide comprehensive care to a complex group of people, right? So these are the things we have to keep in mind. And we can't forget the kind of the social support that we have to provide these individuals, right? You're taking someone who's, if not from that community, putting them somewhere where they don't have any friends, they don't have any family, they're not part of that culture, and now you want them to live and thrive, right? I was talking with Senator Argall yesterday, and I joked, I said, everything is in line for Tamaqua. Now we just have to have some matchmaking services so that when these individuals come, you know, the last thing we want is to take a provider, put them in a rural area, right? We gave them a scholarship so they don't have to worry about that. We've set them up in this beautiful facility. But now 2 years later, we're faced with a mental health situation because this individual is stressed. And they may turn to substance use disorders. They may turn to so many other things that we didn't want to happen, that we didn't think about, right? So we really have to take that holistic approach of supporting these individuals. And it does take a village, and it does take the community to do that for a lot of these individuals. But it all starts right here. Thank you all.